Hello friends, welcome to Kavita Medicos Education, and today's disease condition is cystic fibrosis. So let's start with the definition of cystic fibrosis. So cystic fibrosis genetic condition. So it's a hereditary disease condition. It means it will pass from one generation to the other generation, from parents to the offspring. Okay, so it's a hereditary disease condition, genetic disease condition, and it's a multi-system disorder. Means the various organs or various system of our body are affected through the cystic fibrosis. So mainly which system it will affect? It will affect the respiratory system, our digestive system, means our GI system, and the organs which are involved in the GI system, like we have stomach. It will affect the stomach, it will affect the kidney, it will affect the liver as well as the pancreas and the intestine. So it will affect the GI system, and it will also affect the reproductive system into our body, and it will also affect the integumentary system of our body as well. So why this condition is generating into the patient? It is caused by mutation. There is some deletion or mutation in the gene. Okay, so which gene? So there is a mutation in the CFTR gene. This condition is caused through the deletion or mutation in the CFTR gene. So what is the full form of CFTR? That is cystic fibrosis transmembrane conductance regulator gene. Okay, so when there will be mutation, deletion or any change in the CFTR gene, then the cystic fibrosis condition will generate. So it's a autosomal disease condition. It is a autosomal recessive disorder. So we know that we have 23 pair of chromosome. Okay, and out of 23 pair of chromosome we have 22 autosome. Okay, we have 22 autosome and one we have sex chromosome. So here I am talking about autosomal recessive disorder. So this disease condition happen in the chromosome number 7. Okay, so in the autosome we have chromosome number 7. Okay, and in the long arm of chromosome number 7 we have CFTR gene. So when there is a mutation in the CFTR gene, then what will happen? The CFTR protein will not generate into the body, and this CFTR protein is also known as phenylalanine. Okay, that is known as phenylalanine. So what this CFTR protein does into our body? Okay, so we have phenylalanine protein is mutated here. So this CFTR protein regulates the chloride, sodium and water balance into the lumen. So what is the lumen? So we have tract into our body. Okay, so this free space is known as lumen. This empty or free space inside the tract or air passages are known as lumen. So this CFTR gene produces a protein known as CFTR protein, and this CFTR protein regulates the chloride, sodium, water balance inside this lumen. Okay, if this gene is mutated here, then the phenylalanine or CFTR protein will not generate, and this balance will be not maintained. That's why the thick sticky mucus will generate inside the lumen or free space. Okay, so due to the mutation in the CFTR gene leading to the production of thick sticky mucus in various organs. So in our various system and in various organs, a thick sticky or heavy mucus will generate. Okay, so basically through the cystic fibrosis, this cystic fibrosis affect the cells which produces mucus into our body, which produces sweat into our body, and the cells which produce digestive enzymes into our body. So, and the organs which are affected through the cystic fibrosis are known as lungs. It will affect the lungs. Okay, so in the lung, thick heavy bulgum will form and patient will not able to respirate properly, and into this thick sticky mucus a lot of bacteria and microorganism will generate. Okay, next we have liver. So liver will not able to digest the fat properly, and in the stool we can see the steatorrhea condition in the patient. Next we have intestine. Patient will have difficulty in passing the stool. Next we have pancreas. The pancreatic enzymes or pancreatic juices will not release properly from the pancreatic duct, and the food will not able to digest properly. Next we have reproductive organs. In male there is a thick production of semen. Okay, and in females there is a thick production of mucus from the cervix, and the infertility condition can be seen in the male as well as in the female. Next we have kidney, next we have integumentary system. So the CFTR protein regulates the sodium, water and bicarbonate balance inside the lumen. So this was the definition of cystic fibrosis. Next we have etiology or causes for the cystic fibrosis disease condition. So what is the cause for the cystic fibrosis? So the main cause for the cystic fibrosis is the mutation. Okay, mutation means there is a change or there is a deletion or there is a formation of dysfunctional protein. So whenever there is a mutation in the CFTR gene, okay, and this CFTR gene is present in the chromosome number 7. So what is the full form of CFTR? CFTR means cystic fibrosis transmembrane conductance regulator gene. So whenever there is a mutation or change in the CFTR gene, then what will happen? The patient will suffer from the cystic fibrosis disease condition, and it is an autosomal recessive disorder. So what do you mean by mutation? Mutation means there is a deletion of gene or there is a dysfunctional protein formation. So why this CFTR gene is important? Because this CFTR gene forms a protein that is known as CFTR protein or phenylalanine protein. Okay, and this CFTR gene is present in the 508th position in the chromosome number 7. Okay, in the long arm of chromosome number 7. So this CFTR gene forms a protein that is known as CFTR protein or phenylalanine protein. So why this protein is important? Because this protein functions as a chloride channel. Okay, it is working as a channel for the ions. Okay, so this chloride channel is present in the epithelial cells. Okay, so this protein is helping in the regulation of movement of chloride, sodium and water balance. Okay, so basically it is maintaining the water balance inside and out of the cell. Suppose here I am taking example of here I am giving an example. Okay, so this is a tract. Okay, so this cystic fibrosis is a disease condition of exocrine glands, the glands which have duct present in it. So here I am taking a duct or a tract. Okay, so these are our epithelial cells. This is the inside view of a cell. Okay, so whenever the chloride ions, okay, whenever the chlorides, bicarbonate and water ions will move inside the cell through the chloride channel. So this protein is acting as a chloride channel. So this protein is acting as a gateway channel, and this free space is known as lumen. The inside space of a tract is known as lumen. So when this chloride and bicarbonates will enter into the free space, into the lumen, then what will happen? Automatically the water will also enter. Okay, so the water will also enter into the lumen, and that's why the secretion which are formed into our body, they are very thin, not very sticky, not very viscous. If this CFTR gene is mutated, then what will happen? Due to the mutation, a dysfunctional or no protein will form. Then what will happen? The water will also not enter into the lumen or free space, and the mucus or digestive enzymes which are formed inside this tract, they will be very thick, they will be very sticky. Okay, and patient will suffer from various organ failure disease condition that is known as cystic fibrosis. So how this cystic fibrosis disease condition transfer into the offspring? So here male and female both are the carrier of cystic fibrosis disease condition. So the recessive gene I have shown through the red pen. So this small r and small r are the recessive gene which are present in the male as well as in the female. Okay, both parents are carrier of the cystic fibrosis disease condition. Okay, so through the Punnett square, this capital R is mixed with this capital R. Okay, so the normal of first child, they will have a normal child. So there are 50% chances that they will have a normal child. Again, when this capital R is mixed with this small r, then these carrier childs are formed. Okay, so these childs will be the carrier of this disease. Okay, because they have one dominant gene and they have one recessive gene of cystic fibrosis, so they will be called as a carrier of the cystic fibrosis disease. So there are 50% chances of carrier, and the child which is affected through the cystic fibrosis disease condition that I have shown through the small r. Okay, so this child is suffering from the cystic fibrosis disease condition. Okay, so it is a genetic disease condition. So now what are the risk factors for cystic fibrosis? So the main risk factor for cystic fibrosis is the family history. Okay, if in your family any sibling or grandparents or parent is having a cystic fibrosis disease condition, then there are more chances that the upcoming generation or offspring will suffer from the cystic fibrosis. And cystic fibrosis disease condition is seen mainly in the Asian Europeans or in the white peoples. So next we have pathophysiology of cystic fibrosis. So what is the pathophysiology for cystic fibrosis? So whenever there is a mutation in the CFTR gene, the CFTR gene is present in the chromosome number 7. Okay. So what will happen after the mutation? Then there will be defective or absent CFTR protein is formed. So due to the mutation in CFTR gene, an abnormal or absent or defective protein will form that is known as CFTR protein. Okay, so this CFTR protein work as a chloride channel. It works as a gateway for the chlorine and bicarbonate ions. Here I have shown it through a respiratory tract diagram. Here I am taking one air passage. Okay, so inside this air passage the free space or the empty space is known as lumen, and the blue one are known as the epithelial surface layer, which I have shown here. Okay, so this blue one is known as epithelial surface or epithelial cells, and the green one are the chloride channel or CFTR protein. This green one are known as chlorine channel or CFTR protein, and this red one is known as ENaC channel, sodium channel. So why this CFTR protein is important? Because the CFTR protein work as a conductance membrane or a gateway for the chlorine and bicarbonate ions. So this CFTR protein will transport the chlorine and bicarbonate ions inside the lumen. Okay, they will transport the chlorine and bicarbonate ion inside the lumen. So when maximum amount of chlorine and bicarbonate ion will enter into the lumen, then it will inhibit or stop the activity of ENaC channel, that is sodium channel, because some amount of sodium ions remain presented into the lumen also. Okay, so when this CFTR protein works, then it will inhibit the activity of ENaC channel or sodium channel. Okay, because why it is inhibiting the activity of sodium channel? Because some amount of sodium ion and some amount of chlorine ion remain present inside the lumen. That's why they will form a salt that is known as NaCl. So when the salt is present inside the lumen, then what will happen? The water channel I have shown through the blue diagram, blue dot. Okay, so this water will eventually enter into the lumen. Okay, this water will automatically enter inside the lumen because salt is present here. In this way, a thin mucus or secretion or digestive enzymes are formed inside the lumen. But due to cystic fibrosis disease condition, there is a mutation or there is an abnormal protein is formed. So impaired chloride channel. So due to this mutation, what will happen? It will impaired. Okay, it will impaired or stop the activity of chloride channel, and ENaC channel is not inhibited. Now due to the mutation, this CFTR protein will not work. When this CFTR protein will not work, then it will not able to inhibit the activity of ENaC channel. Now ENaC channel will act in very rapid way. Okay, this ENaC channel is now not inhibited because there is no CFTR protein or no CFTR gene is present. Okay, no gateway is present, so it will not inhibit or stop the activity of ENaC channel. In this way, the ENaC channel will work in very fast way, and it will reabsorb the maximum amount of sodium inside the cell surface. Okay, see, increase sodium absorption by the epithelial surface channel. Now this ENaC channel will reabsorb the sodium back inside the epithelial surface layer. When the sodium will enter inside the surface layer, then what will happen? The water which is present inside the lumen, it will also get reabsorbed back into the epithelial surface layer. Due to the sodium ions, the water molecules will also reabsorbed back into the epithelial surface layer. Okay, so see, decrease water movement in lumen. Water is not going inside the lumen because there is no sodium ion present, and our CFTR gene is not working, and the chlorine ion is not present inside the lumen. Now water will not move inside the lumen, and more water is absorbed in the epithelial surface layer. Now this epithelial surface layer will reabsorb the water back. Okay, so what will happen? The secretion which are formed inside the lumen, it will be very thick, it will be very sticky, and very viscous type of secretions are formed. Okay, so this was the process for our GI system, for our reproductive system, and for the respiratory system. But if we talk about integumentary system, so in integumentary system what happened? The sodium ions, the chlorine ions, and the water molecules get inside the epithelial surface layer. Okay, they will come inside the epithelial surface layer. So whenever a mother kisses her baby, then the baby sweat is very salty. Okay, so this process happens only in the GI system, in the respiratory system, and in the reproductive system. So this was the pathophysiology of our cystic fibrosis.